As members of Catholic Medical Partners, we promise to promote a higher standard of care in Western New York.
We promise to give the patients who choose us a resounding voice in their health care.
We promise to listen.
We promise to educate.
We promise to advocate.
We promise to care for our patients, mind, body, and spirit.
That is our mission.
That is our calling.
That is our promise to you.
Why is Millard Fillmore Suburban Hospital the most comprehensive hospital in the suburbs? Because our team has more ways to take care of you. From our fast care in the emergency room to award-winning orthopedic care, nationally recognized women's services, and much more. At Suburban, you get a hospital ranked as one of America's best in one of America's safest towns. Millard Fillmore Suburban Hospital. Exceptional setting, exceptional care.
Players, you know them when you see them. They have a look. It's confident, tour tested. It says, I'll give you a stroke a hole and still take your $2 Nassau. Be a player. Shop Golf Galaxy.
You're so incredibly overwhelmed.
She's young, she has small children. That could be me sitting there.
One of the things that she said to me that I'll never forget is, we're going to make this better because you have to be a mom to your kids. In that moment, I believed her.
Yeah, I'll tell patients I do my surgery at ECMC, and sometimes I'll get, really, ECMC?
It's not what some folks might expect. You walk in and it's quiet and calm, very clean. They expect to see chaos and they expect to see trauma, but they don't.
They do care. They treat everybody like it was their mother or sister.
Even though I was there just for a day in, day out surgery, somebody kept coming out and saying, okay, here's where she is now and she's fine. They didn't have to do that.
That's what the patient remembers, that somebody really cared about how they felt.
New Jersey, we call it one of the most wealthy states in the country, and it is. The cosmetic sales tax came about as a result of a government desire for money. It was designed literally to meet a budget shortfall that we had been incurring in New Jersey. As a result of that, I sponsored the bill, and 8 days later it became law. This was a well-intended bill, designed to raise $25 million or so, and frankly failed miserably at doing that. For everyday folks who this has affected the most, it is not the wealthiest state in the country. It's the state where you fight to get by. To create this type of onerous tax was a mistake. No legislator should have what I have, which is the signature on a bad piece of public policy that's become law. The way the treasurer of the state of New Jersey put it to me, it has been an absolute nightmare to collect this tax. It is simply unenforceable, and it has been a nightmare. By classifying the cosmetic surgery as a taxable event, you've now opened that up to audits. You have to collect for certain procedures, but not for others. The idea of trying to separate the amount of tax that's created per procedure and then put physicians on the line to actually defend that. So now you've put the doctor at the disadvantage, saying we think you should have paid this. As a result of that, it's created an entire flight of physicians, either to New York or Pennsylvania. When we create conflicts between auditors and doctors, nobody wins. It also becomes frightening to the actual consumer, to have the opportunity to change their appearance, to have the opportunity to feel better. That is about as private an emotion as one can have. Those privacy issues are very, very real. The privacy issues under HIPAA and the rest have made it so you can't go in and audit each individual file. And those procedures, literally 70% or more, are done for women. This is a tax that, just by balance, affects women more than men overall. This is about working women who save money, who want procedures. So what I understood it to be, and what I've learned, unfortunately, along the way, is that it's not only an unfair tax, it's a tax that's disproportionate to women, it's a tax that's disproportionate to working people. I'd never recommend to anyone, any other legislator who's considering sponsoring this legislation, actually do it. We chased so much work and so much opportunity out of our state. That's not something any public person wants to do within the community they represent, that's what happened here. We always perceive ourselves here in New Jersey, as I think every other state does, that we're number one in everything, that we have the best of everything. The idea that we would lose people, lose jobs, and lose, frankly, opportunities for our citizens never crossed our mind. And that's what happened. This bill collects a minuscule of money in comparison to how much it was expected to raise. For every dollar we've gained, we've lost $3.39. You don't need to be an elected official to know that that doesn't quite add up. The repeal of this legislation happened a couple years later and actually passed both houses of the legislature unanimously, one of the few times in New Jersey that Democrats and Republicans completely agree. You look for that fight for the middle class. We talk about it all the time. We're fighting for the middle class. We're working for the middle class. And most of us perceive ourselves as the middle class. This is an anti-middle class bill. This was a good idea gone bad, and I would strongly recommend anybody considering, don't do it.